balance out. Up and down, nice and slow. Do it 3-4 times. Up and down on that side there. And that is K20. Next exercise, we have the straight leg raise with the ankle weight. So this is just how you would advance from just the regular straight leg raise. Ankle weight here, just wrap around, let's say the right. It's affected. Strap it to your ankle. Lay on your back. Sit down. You start the bolster. Well, no bolster. Straight leg raise. Toes going to be pointing toward them. Just going to raise it as high as the opposite knee. Hold for about a second or two, and slow all the way back down. That's a straight leg raise. Next, we have the next exercise, which is the TKE with T-band. TKE stands for total knee extension. This is someone who their leg doesn't extend all the way back. It's slightly bent all the time, so we want to strengthen those muscles back there. If you have anything to tie it off to, like we do here at the Hillsborough office, tie a loop around there. We tie a loop back here. So you would have the patient feet next to each other. One knee slightly bent, the opposite leg straight. My heel is on the ground, it's not up here. So that's a key indication for this one, to make sure the patient has the heel on the ground. And you're just going to have the patient extend their knee back, hold for about 5 seconds. Really activate that quad there. Should be really tight. And slow on the way back. The heel stays down. That's total knee extension right there with the TheraBand. Have them hold that for 5 seconds. Next exercise we have is just a step up. This is about a 6-inch step right here. Step up, you just go up with the affected, down with the affected. So if the left is the affected, I'm going up, and then back down with the left. That's the basic step up right there. Next we have, I'm going to go to the table next, which is K25. This is the short arc and long arc quad. So this one is the short arc, just the bolster under the knee. If the right one is the affected, make sure the knee pushes on the pillow. You're just going to extend that knee up, pulling the toe towards you. Really tighten that quad muscle there. Usually hold this for 3 to 5 seconds. Nice and slow, controlled. Make sure they're not holding their breath or anything. And this one I have with the weight, so you just strap the ankle weight on the ankle there. And that's just short arc. Long arc, we have just sitting on the edge of the table, feet are dangling. If the left is affected, we put the ankle weight on the ankle. You just have them pull their toe towards you. This is to strengthen that quad muscle there. Nice and slow on the way up, slow on the way back down. And usually the short arc you would do first. It's easier than the long arc. Next we have K26, which is the heel tap. You use a step anywhere from 2 inches to 6 inches, 4 inches as a step there. So you just have if the left leg's affected, you hang off the right leg and the right leg's straight. You're going to tap the heel on the ground and then back up. So this one you're going to make sure their knee's not wobbling back and forth, that their body's in a straight line. Your knee goes straight down. A little difficult to do in dress shoes. Back up. So these are known as heel taps. And if the right's affected, you would do the opposite. Just watch the control of the knee there. Nice and slow. And then next we have single leg balance. I've written down the Bosu, using the Bosu or a pillow or a piece of foam. Here we have like a dino disc. This is just to challenge your balance a little bit more. Just single leg balance on this. Trying to hold that for about 10 seconds, work your way to 15 seconds. Alternate legs. Next we have K28. It's the basic lunge. So we're just going to do both feet on this one. Lunging down, knee almost touches the carpet. Right there. Straight up and down.
Yeah, what's up, dude?
They're not leaning forward or leaning too far back. That's K28. And then the last one is the physio ball squats. I'll grab the physio ball. Just tell the patient to put the ball in kind of the arch of their back here. And they're leaning on the wall at an angle. This makes sure that their knee doesn't pass the front of their toe. Just takes less pressure off the knee. Have them squat down so they're about 90 degrees at the hip and knee. Hold for 3 to 5 seconds and then squat back up. Down. That's the last exercise of the phase 2 of the knee.